I think a lot of people, when they think chiropractor, is that you go in and you get cracked in 5 minutes and then you're out the door, and it's like this one little tune-up. What actually happens? Like, you kind of went over a little bit, but what happens in your clinic? Like, what's your process from beginning to end?
So it depends on the type of injury. So let's say that somebody was playing soccer, playing whatever sport, and they took a fall, they took an injury. I'm going to take a good history, look at their past medical history, take that into consideration, because we need to also evaluate, did they have other conditions that occurred when they were younger that might be, manifesting once again. Then we will use imaging of the region that is affected in the injury to determine what's going on and look at the quality of the joints, the segments, make sure the alignment's right. And then we begin with probably some muscle work to initiate movement and to make sure that everything's moving full range of motion without too much pain. And then we'll begin to start moving, whether it's the pelvis, the thoracic spine, the cervical spine, whether it's a hip, a knee, an ankle. I've been trained in all these different extremity courses. I've been trained in various techniques. So I also use probably about 8 different techniques depending on the individual case. When you look at a car accident, we have to be respectful, as I mentioned earlier. A car accident occurs in about 300 thousandths of a second. So in less than a third of a second, the impact occurs. If somebody looks in their rearview mirror and they see it happening, when that impact happens and they try to tighten up, the human body requires approximately 400 thousandths of a second for it to react and tighten up. So the accident's already happened. Now, what happens in an accident? Let's say it's a rear end collision or a side impact collision. The body goes through its full range of motion, but then it goes into what's called a paraphysiological space of the joints. It goes beyond that, and it'll actually sprain the joint. What's very interesting is that sprained ligaments, which are the structures that hold bones together, they never heal. They never, ever heal. And I think that's very important for people to understand. They will remodel with substandard tissue. They will come to a point of maximum medical improvement, but it's never the same as a uninjured ligament. And that's important to diagnose, and more importantly, to document. So early on, my diagnosis procedure is going to be in depth. We're going to look at, I want to see photos of that accident. I want to see what kind of property damage. And it's interesting because certain accidents with certain vehicles will result in a much lower level of severity of injury than other vehicles in the same exact accident. And it's because of plastic deformation, which occurs in the vehicle itself.
What did you call it?
Plastic deformation.
Okay.
And it's a term that has to do with like the crumpling of the metal of the vehicle. Engines are designed in certain vehicles that are high end to drop down out of the way when a car gets compressed, so that that engine doesn't come back and possibly cause a fatality that could have been avoided. When you look at your higher end cars, they sacrifice so many vehicles in crash tests. And why do they do that? For the safety. That's why people seek out Porsche, Mercedes-Benz. Those are great vehicles. They are designed for that. And many other car manufacturers will buy those vehicles, crash them, and determine, how can we make our vehicles better by respecting, Dr. Porsche's work that he did. Mercedes, look at what those vehicles have brought to the world. People walking away from accidents, that most people would say, my gosh, somebody had to die in that. So the diagnostic procedure is something that takes time. My initial visit for a car accident case or a serious injury, the patient's probably going to be here an hour and a half, possibly 2 hours, because I don't take this lightly. And it all stems from that accident that I had, almost 40 years ago that almost took my life. At that time, nobody did this kind of stuff. They're like, he's alive. We stitched him up. He's got a broken bone. He needs surgery. Nobody looked at all the other factors that came into play. The brain injury that occurred from me hitting my head so hard. There's a lot that goes into diagnosing an auto accident case, a fall from a building, a fall that occurs, or somebody having a sporting injury where they take a hard hit. A lot that goes on, and we don't have enough time to go through all of that.
No, but it's fascinating. And what I'm kind of hearing, and I want to touch base on it because I was going to ask a few other questions along this line, but I think it's something relevant, is that I'm seeing, as I go and see my primary care, I'm seeing I'm hearing from them as well, like in the privacy, that they're just getting less and less time with their patients. They're going in, they're seeing this chart, and then they're saying a bunch of stuff. It's very prescription style medicine, and it's out the door, and they're on to the next one. And I've had several doctor friends of mine that have like become disillusioned in that. They've actually left that side of the business to start their own like concierge types services where they became more holistic in their practice. But I'm also hearing in yours is that and I'm kind of seeing this now, is that like chiropractic is becoming a holistic form. It's that doctor that we used to have, probably, 100 years ago, that would actually pay attention and spend time and really get to know everything as much as the information they had. So I just wanted to touch base on that I'm really just acknowledging that I'm seeing like 1 to 2 hours first time visiting a patient. I couldn't imagine a doctor spending that amount of time with their to get to really know what the root cause was.
Thank you for that. Much of what you're talking about occurs because of sick care or healthcare insurance. And that's because the doctor is going to be paid by the insurance company a certain fee for his evaluation, and that's it. And it's a numbers game. They need to see more people in less amount of time. Most of the time, the doctor will see the patient for about 3 minutes, 5 minutes tops. That's not the case with me. It can't be. It's just not the way I run it. And yes, we don't make as much money as some of these big clinics, but the care level that people get, if you look at, I haven't looked, but I've heard that we've had great reviews because of the time I spend with patients and the care that we give. At most physicians' offices, you've got an MA that's going to spend most of the time with the patient. Sometimes it's a nurse practitioner, which is great, but it's very rare that patients spend quality time with the actual physician because they just don't have the time. They have to be running from room to room to room to see patients. And what's really interesting also is that traditionally patients have been expecting a prescription because why? We see that on television. You've got this ailment. All of a sudden, these people are playing ball and they're having a great life because this prescription has brought them to that level. They can enjoy life again. The reality is, no, that's not what's going on. These prescriptions are actually changing their life, and maybe it's helping to some degree, but what about these side effects? So when you talk about the concierge lifestyle that so many physicians are going to because they've gotten sick and tired of that. Many providers, and I have friends that are medical doctors, they've gone to that concierge model, and I applaud them at that. They said, you know what, we're not doing this anymore. We're going to have a membership fee that patients pay, and they get to call. They've got my cell number, and they get to see me whenever they need to. And that's really where many doctors are going towards, because they're realizing, many of the younger doctors that are coming right out of school, they're doing their time, they're at their ERs and such, and they're like, I don't want this anymore. I want to have a practice that rewards me emotionally and spiritually, that I'm helping people as far as their life is going, as compared to just writing a script and here you go, Joe. I got to go. Nice talking to you. So the concierge lifestyle is because more and more people are wanting and expecting more. And so many chiropractors have gotten into that. They're big into nutrition. They're big into testing. They're looking at bioidentical hormones. They're looking at various ways of boosting somebody's immune system naturally. And that's something that we're getting into also, so that we can have a well-rounded approach at keeping people healthy without medications, without surgeries, unless they're necessary. And believe me that I will send patients for the proper diagnostics or send them to the right physician when I think it's necessary. And many times, especially in big injury cases, or most injury cases, I want that patient to visit an orthopedist. I want them to visit a spine specialist. I want them to see if we need be an interventional pain doctor, because there's a lot that we can work together as a team for that patient to help diagnose their problem, help get them the proper care, manage their recovery. And in my case, it's all about documentation. If we don't document that, that patient is going to have a tough time closing out their case. Whoever, all the documentation needs to be spot on to make sure that we're showing where the patient came in at and where they finally wound up at when they reach maximum medical improvement.